Hello and welcome. Today we're diving deep into a condition affecting the urinary system, specifically bladder neck contracture. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. So, let's get started. Bladder neck contracture, often abbreviated as BNC, refers to a narrowing or tightening of the bladder neck. This area is crucial, as it's the point where the bladder connects to the urethra, the tube that carries urine out of the body. The most common cause of bladder neck contracture is previous surgery on the prostate gland, especially procedures like transurethral resection of the prostate, or TURP. Less frequent causes may include radiation therapy to the pelvic region, trauma, or rarely, congenital abnormalities. The pathophysiology of bladder neck contracture is relatively straightforward. Scar tissue forms at the bladder neck, causing it to narrow. This narrowing obstructs the flow of urine from the bladder into the urethra. The bladder muscle then has to work harder to push urine through the constricted opening. Over time, this increased pressure within the bladder can lead to bladder muscle hypertrophy, or thickening, and eventually, bladder dysfunction. In severe cases, the back pressure can even affect the kidneys. Bladder neck contracture predominantly affects men, primarily those who have undergone prostate surgery. The exact incidence varies depending on the type of surgery performed and other factors. However, it is estimated that a significant percentage of men undergoing TURP or similar prostate procedures may experience bladder neck contracture at some point. Understanding these figures helps clinicians and patients alike prepare for potential complications following prostate surgery. The symptoms of bladder neck contracture are often related to difficulty urinating. These can include a weak urine stream hesitancy, or difficulty starting urination frequency, or the need to urinate often, urgency, a sudden and compelling need to urinate, nocturia, or waking up at night to urinate, straining to urinate, and the sensation of incomplete bladder emptying. In some cases, urinary retention, or the inability to empty the bladder at all, can occur. The severity of symptoms can vary depending on the degree of narrowing. Diagnosing bladder neck contracture involves a thorough medical history, physical examination, and specific diagnostic tests. A doctor will ask about your symptoms, past medical history, and any previous surgeries. A digital rectal exam may be performed to assess the prostate. Common diagnostic tests include uroflowmetry, which measures the rate and amount of urine flow, cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the urethra to visualize the bladder and bladder neck, and post-void residual measurement, which determines the amount of urine left in the bladder after urination. These tests help confirm the diagnosis and assess the severity of the contracture. While we don't classify bladder neck contractures into distinct types, the severity of the contracture can vary. The degree of narrowing can range from mild, causing minimal symptoms, to severe, leading to significant urinary obstruction and requiring intervention. The extent of the scar tissue and the impact on urinary flow dictate the clinical approach. Treatment for bladder neck contracture aims to relieve the obstruction and improve urinary flow. Treatment options range from conservative measures to surgical interventions. Initial management may involve alpha blockers, medications that relax the bladder neck muscles, although these may not always be effective. Surgical options include bladder neck incisions, a BNI, where small incisions are made in the bladder neck to widen the opening, transurethral resection of the bladder neck, a TURBN, similar to TRP, where tissue is resected from the bladder neck, and open or robotic reconstruction of the bladder neck, a more extensive procedure used in complex cases. The choice of treatment depends on the severity of the contracture, the patient's overall health, and their preferences. Unfortunately, there's no guaranteed way to prevent bladder neck contracture after prostate surgery. However, meticulous surgical technique during prostate procedures can help minimize the risk. Patients should discuss the potential risks and benefits of different surgical approaches with their urologist. Regular follow-up appointments after prostate surgery can help detect and manage any developing issues early on. The prognosis for bladder neck contracture is generally good with appropriate treatment. Most patients experience significant improvement in their symptoms after undergoing surgery or other interventions. However, recurrence of the contracture is possible, so ongoing follow-up is important. Recent research is focused on developing less invasive techniques for treating bladder neck contracture and on understanding the underlying mechanisms of scar tissue formation to prevent recurrence. This includes investigating the use of newer surgical technologies and pharmacological agents to modulate the healing process and minimize scarring.